Hi guys, welcome back. We are discussing core foundations today. We'll be reviewing some material that we've already discussed, as well as diving into some new items. And as usual, we'll be going on some tangents. And also, this is a precursor to the two core activity days that we have coming up. We've seen this slide before in our anatomy review section. Let's take a closer look here, particularly at that upper left image. Taking a look at those muscles that are closest to the spine, multifidus and the transverse abdominis. And those are going to be two muscles that we will cycle back to down the road, but these are really ones that we're trying to address because they are going to really be paramount in just keeping our spine healthy and safe, and preventing disc herniations. Getting those strong is going to boost performance because of our ability to stabilize the spine as well as perform athletic movements. And this is sort of that front image of it. When we think about mirror muscles, this is kind of what people often focus their efforts on the core on. So diving in, looking at that rectus abdominis there, everybody wants that 4, 6, or 12 pack or whatever they're working on. And that rectus abdominis is going to be useful as a stabilizer, especially in the weight room when we're performing movements in the sagittal plane. But when we start moving around a little bit more, we're going to want that transverse abdominis to be active and put a much bigger emphasis on stabilization of the spine. To revisit our lower cross syndrome discussion, when some of these muscles are getting out of whack, what's most common, I find, is that the hip flexors tighten up due to sedentary activity, too much sitting, an imbalance of push-to-pull ratios in the weight room. When the hip flexors tighten up, they're going to pull that pelvis down in front, and as that pelvis comes down in the front, it's going to shift up in the back. So we get an anterior pelvic tilt, which is going to cause a lot of lower back pain. And although the pain is centered and radiating from the lower back, the issue is multifaceted. So again, looking at strengthening and training abdominal muscles, activating and training our glutes, lengthening and being nice to our tight hip flexors, and lengthening and being nice to our tight spine erectors. There we go. And again, for our anatomy review, a mnemonic device that I was taught that has helped me remember the layout of the vertebrae in the spine is that there's 7 vertebrae in the cervical spine, 12 in the thoracic spine, and 5 in the lumbar spine. And what I was taught and what has really stuck with me is that you're going to eat breakfast at 7 a.m., lunch at noon, and dinner at 5. And knowing a little bit more about the vertebrae of the spine is going to help as we are looking at the joint-by-joint approach, which is a theory and thought process by Coach Mike Boyle, in where there's alternating joints of stability and mobility. And what we really want to do is focus and emphasize our thought today on the spine, is that lumbar spine and cervical spine will be stabilized, while the thoracic spine will be mobilized. And another teacher or leader would be Stuart McGill. And on day 1 of our warm-up activity day, we went through the McGill Big 3, or 3 exercises that are really going to help stabilize the spine and reduce injury. And Stuart McGill has a saying, is spare the spine. that the majority of low back pain results from an inability to stabilize lumbar spine. So that's kind of our goal, is that we want to stabilize what we need to stabilize and mobilize what we need to mobilize. So if we are able to stabilize that lumbar spine and actually get our movement to come from the thoracic spine, where our bodies are actually pretty well prepared to do that, then we can help maintain a neutral spine, a healthy, safe spine, while performing athletic movements. So we don't have to walk around like robots, where there's going to be rotation, there's going to be flexion and extension, but it needs to come from the right spot. And for our purposes, that's essentially going to be your thoracic spine. And what does the core actually do? We've all done countless crunches and sit-ups, but at the end of the day, what is that core supposed to be doing? And I would say that the core is actually not producing much force when it comes to rotation, but what it's really doing is stabilizing and helping transfer force. If we look at our lifter in the upper left there, performing an overhead squat, what is the core actually doing here? Well, for the most part, it's just helping to stabilize that spine. And that spine is not going to be as neutral in the bottom of that squat as it is at the top of that squat, but hopefully it's going to be close to that. And any flexion or extension that comes during that squat is hopefully going to occur in the thoracic spine, while the core muscles are firing to help stabilize and keep everything under control. And a similar effect is going to be happening on our female lifter in the middle photo, who is performing what looks to be a Turkish get-up. As that Turkish get-up occurs and going through a range of awkward positions, that spine is going to stay pretty darn stable and pretty darn neutral, but it will have some flexion, some extension, and some rotation throughout the lift. And how about our baseball player at the bottom? To complete that rotation, to complete that swing, the spine will not always stay perfectly neutral, but we want it to stay pretty close, and we want it to be strong throughout. So keep in mind that baseball, during that swing, there's going to be a chain reaction where the hips fire, the feet rotate, and that power that's going to come up through the legs is going to transfer through the core, through the midsection. As the hips have rotated, now the upper body needs to come in just behind that. And so the force that's going to help that upper body rotate hard enough to maybe hit a home run even, or at least hopefully get on base, would be that the core is going to be transferring that force from the ground up into the shoulders. And if anybody has ever done rotational exercises in the gym or weighted flexion and extension exercises, you know that a lot of times we rely on other muscles to help do the job. So take, for instance, my 2-year-old daughter. She has a six-pack right now, that little stinker, but she has a six-pack, but she can't do a sit-up, because a sit-up, she doesn't know how to rely and call on her hip flexor muscles to accomplish that. And also she's super top heavy, because kids are built to be funny. So she's got, her head is a bigger part of her mass than an adult will be, hopefully. But the sit-ups and crunches that we've been performing are not always paying off. Even as far as developing muscle, it's kind of arguable is the flexion, extension, and rotation exercises that we've all been performing for years, is that actually going to help us perform or reduce injury or even look better on a beach? I would say that absolutely there's going to be a little bit of each. Unfortunately, there's a better way. When we do anti-rotation, anti-flexion, anti-extension exercises, we are activating the muscles without stressing the joints. And that's exactly what Stuart McGill has found in his research, is that the countless crunches and sit-ups are creating flexion and extension of the spine that ends up sort of stressing that spine a little bit and leading to degenerative issues such as disc herniations or even bulging discs. So when we do exercises like the prone bridge, which is extremely popular, kind of that push-up, you can either perform it in a push-up position or you can go down on the elbows, is you're actually getting quite a bit of muscle activation in that position. That's an isometric contraction, as we're not moving and the emphasis is to stabilize the spine. And if we look at exercises like a squat, again, the squat is actually not that much of a leg exercise as it is a core exercise. Because what's the limiting factor for the vast majority of lifters who are performing a barbell bag squat? It's their core, it's their midsection. That's gonna be the limiting factor, the weak link. So if you want to develop a stronger core, you could absolutely include some squats. But if you notice that your core is limiting your squat, you would then maybe prioritize some additional core stability exercises. So some exercises that help us feel the burn and help activate muscles and create fatigue, but may be stressing our spinal cord and vertebrae a little bit more than we want to, would maybe be an oblique crunch on the side, a windshield wiper laying on the back, the inverted hyperextension sit-up that almost kind of hurts to look at. Although I will say, as this is a movement that's been involved in multiple CrossFit competitions, it's very tempting to go do an exercise like that when you see high-level athletes with incredibly well-developed cores and physiques performing that movement. But the science tells us that maybe it's a little risky and it may not be for everyone, and it may cause some extra stress on the spine that is potentially not really worth it. And then in that bottom right, I believe that is a scorpion stretch. And if you kind of look at the way that the graphic or the sketch's upper body is pinned to the ground and is not allowing for much rotation through the thoracic spine, you'll see that that red highlight is down that lower back, so more like the lumbar spine. And that's one of the biggest problems with altering the way we were born to move, is that there's going to be compensations in other areas of the body. So if we're not mobilizing and moving through our spine, through our thoracic spine, we're going to try and get the job done from some other space in our body. And when we start compensating, we start having an increase in issues, whether that's health problems or a decrease in performance. So a quick reminder, now we visited these stabilization movements on day one of our activity day for warm-ups, but this graphic will help us remember what we did and why we did them. And McGill 3 is not bad. It's not a bad idea to include this almost any day you're going to load the spine or be producing some explosive activities. And again, that spine, that lower back injury is going to be the number two reason why Americans visit doctors. And you can have disc herniations, bulging discs, you can have muscle strains, you can have just that lower cross syndrome, which is causing pain, but is not causing trauma in the lower back. But eventually, with that pelvis out of alignment, other parts will start to break down as compensations become more common. So we've talked about stabilization, but what about mobilization? And we did some mobilization movements on our warm-up days, on our warm-up activity days, and we'll do some more mobilization on our core activity days, which are coming up just after this video. But if you have a greater curiosity or you want to see more, I would highly encourage you to seek out Dr. Kelly Starrett, who has pumped out many, many videos on YouTube, has written a few books, and as a doctor of physical therapy and a practitioner of strength and conditioning, he's been in the trenches and he's got a lot of great material. So I would encourage anybody who's seeking some help or seeking some knowledge to dive into the teachings and the work of Dr. Kelly Starrett. So just a quick image or insight into what a disc herniation is going to look like. So on that lower left, we've got the normal disc, and with poor movement over time or an acute trauma, that disc can herniate and allow for some nerve irritation and pain. And quite a few of us probably have multiple disc herniations, and that's just going to come with some age and heightened activity, possibly some car accidents, or being in a car accident, or maybe sledding and landing hard when you're a kid. A lot of times, they've done MRIs and people will have no pain, but they will have disc herniations. And so it's not the end of the world. It's not a death sentence to your lifting or your fitness pursuits or your athletic career. But we can prevent flare-ups and further damage through smart training and through smart preparation. So by keeping our spine as neutral as possible and having the rotation, the flexion, the extension come from where it's supposed to come from and occur to a degree which it's supposed to occur to, we can limit some of these simple injuries like this, whether they're an acute injury or they are a chronic injury. All right, buckle up. We're going to get going on a tangent here. Probably not what you're expecting today was to talk about breathing. Breathing, something we're born doing. You would not think it's even worth talking about. But I will say that it is a space that I have learned more than I can't believe how little I knew about it. And the more I learn about it, the less I feel like I know. So this is a monumental topic area, and we're going to go through a few different facets of it. So PRI, or the Postural Restoration Institute, released a document or an article in which they talk about several different breathing strategies. And one of those breathing strategies was to breathe like a baby. And again, I've got these little kids at home, and being able to see them born and watch them in the first few months of their life, and they're both still breathing like babies. So hopefully I can keep them breathing like babies forever. But what you're going to see in a newborn baby is that when the breath comes in, especially when they're crying and they're wailing in your face and they're, it's the saddest thing you've ever seen, blah, blah, blah. But when they're taking really big breaths, you really can see that abdomen stretch out. They get a big old beer belly, and then it shrinks, and it's just in and out, kind of like an accordion almost. Is that belly just fills up and shrinks and fills up and shrinks. And that's the way we're born breathing. We're designed to breathe that way. And you guys can read through that writing at the bottom there. If you'd like, just pause this and read through it. But we're born breathing that way. And why does it go away? Well, a few reasons. One is the stress of modern day living, constantly being stimulated. That's actually going to have a neurophysiological effect on what muscles are firing. And we're just going to put us in more of a sympathetic stress out state. And that's going to help bring that breathing up into our chest and our neck and our traps. And it's going to put us on that, it kind of puts us on that fight or flight pattern. So there's the neurological stimulus. There's the posture issues that come with slumping over sitting in a car, slumping over sitting at a desk, slumping forward, texting on your phone. And to be paired with all that technological advances, we're no longer working in the fields, hunting and gathering and pulling crops from the ground. So we're not getting the upper back for work and stimulus that we used to. And the United States is one of the we have more back pain than anybody, but we're also more sedentary than anybody. So you'd think the more you relax, the more you are sedentary, you think the less back pain you have, but it's actually the opposite of that. So when we breathe properly, we're actually going to fire our obliques and our rectus abdominis and our diaphragm, all these muscles that fire down around our trunk and our belly. So think about that newborn baby, that big old beer belly that appears and then disappears with every breath. So with a breathing pattern like that, you now have a more stable core because your core is stronger and the air is going down around the lumbar spine, which is where the injuries occur. When we're a chest breather, we're breathing up into the top of our thoracic spine and the bottom of our cervical spine. That's not an area where a lot of spinal injuries occur. So we're reinforcing a space that does not to be reinforced. So the belly breathing helps put the air down by our danger zone and helps stabilize it just with every breath. And you'll also find that athletes who use the phenomenon of breathing into their belly are able to create more force. As they exhale, a powerful or will help the muscles around the lower back contract. So when you time it just right, whether it's a boxer who's kind of doing the as they're throwing fists, or a batter in baseball who exhales or kicks a little bit of air out into their swing, what they're doing is they're firing those trunk muscles to boost their ability to stabilize the spine and produce or transfer force at the same time. So we like breathing, and we like breathing like babies. An easy way to test your ability to breathe like a baby would be to lay on your back, one hand on the chest, one hand on the belly, breathe in through the nose and down into your belly. And what you want to occur is you want your belly to rise, but you do not want your chest to rise. And we'll probably dive into that a little bit on our core days. Let's dive into that on some of our core days coming up so that we can kind of go through it together. Patrick McGowan wrote the book, The Oxygen Advantage, and this is one of a few books about breathing that I've read. And again, I feel silly even saying that because I spent so much time in my career without worrying about breathing. I knew that breathing was important, but as time has gone on, it's become more important. And there's research coming out that makes it even more important. And as much as I've learned about it, I still know that I have a lot to learn about it. So, let's dive into overbreathing a little bit here. Overbreathing, I had never heard that word or phrase until I opened up his book, The Oxygen Advantage. And essentially what's going to happen with the overbreathing is that poor breathing patterns, both the speed of our breathing patterns and the style of the pattern of our breathing patterns, can lead to overbreathing. And when we breathe properly, in through the nose, down into the belly, out through the mouth, with the right pace, we can boost our performance. We can better saturate our tissues and organs with oxygen and reduce our fatigue. So overbreathing is a self-induced breathing pattern that decreases our performance and our state of well-being. And I'll tell, it's such a funky concept. I'll just tell a story real quick. So I read through this book. Actually, I was only halfway through the book, and I went and met with an athlete. And I've been working with this female athlete for a couple of years. And she never had breathing problems during conditioning. She never had breathing problems during big complex lifts, the squat or push-ups or lat pull-downs. But when we got to our isolated arm work, like biceps and triceps, it was very common for her to become lightheaded and rapidly fatigue. And we had been experimenting with some different options and playing around with form and different exercise variations. And basically nothing was working. And as it was for bicep and triceps, these were not a huge priority for me. It was usually something that was occurring towards the end of the workout. And, you just kind of like scratched your head and said, oh, I guess she's just tired from the rest of the workout. But there's such a pattern is that it became so consistent. It was really just mind blowing that this athlete could do everything she could do and then get her butt kicked by basically arm work at the end of a lift. And I'm about halfway through this book and we go and meet and we're training. And I'm watching her and I'm watching her breathe in and out with every rep. And I'm thinking, okay, yeah, like that's usually how we lift. And then I start thinking, well, that's how we lift on our bigger lifts, on our squat, on our upper body presses. That's how we usually lift when we have to do the Valsalva maneuver and we want to really stabilize the spine. But this arm work, these reps occur a little bit faster than those other reps do. So I start thinking about what I'm reading in this Oxygen Advantage book. And I say, hey, this is going to sound crazy, but only breathe like every couple of reps. Slow your breathing down and breathe only when you feel the need to. And also, it's okay if you don't constantly have to be inhaling or exhaling. It's okay to breathe in, hold it, and then breathe out and hold it, and then breathe in. So I say, hey, I know this sounds crazy, but let's slow your breathing down and don't let your reps dictate your breathing. And I'll say that this is probably one of the most dramatic changes I have ever made as a coach, is that on the very next set, there was no breathing problem at all whatsoever. Fatigue and lightheadedness disappeared in basically the blink of an eye. And this athlete had been performing the overbreathing phenomenon or self-induced problem. And so when we fixed that breathing pattern, we actually were breathing less. We were breathing less often, and we were taking little breaks in between inhales and exhales. And this improved the lightheadedness and fatigue that had been taking place. So I say that as a precursor to understanding a little bit of the science behind overbreathing. So look at the Bohr effect. Our red blood cells are saturated with between 95 and 99% oxygen. Even though our blood is oxygen rich and saturated with blood, that does not necessarily mean that our muscles, organs, and tissues will get all of that oxygen. It's the amount of carbon dioxide present in our blood that determines how much oxygen we are able to use. When we breathe correctly, we have sufficient amount of carbon dioxide. If we are overbreathers, we exhale too much carbon dioxide. So the way that's described in the book is essentially that CO2 opens the doors in the cells for the oxygen to walk through. So my athlete, who was kind of hyperventilating and overbreathing through her arm isolation exercises, she had more oxygen coming in, but she actually had too much carbon dioxide leaving her body. And because she was exhaling it at such a rapid pace, she was not able to get the oxygen from her blood into the oxygen in her tissues, her organs, and her muscles. So that's overbreathing. And I would say that as I was reading the book and I was experimenting on myself, and I had that I had that one female athlete who I've been talking about for the last couple minutes. As I experienced that, my mind was blown, and my eyes were open, and I started looking at breathing and my athletes in a whole new way. And I didn't have another super dramatic, light switch moment with any other athletes right then and there. But as I taught more athletes about it and talked about it, I had a lot of these athletes coming back to me and saying, "Hey, yeah, we went for a run today, and normally I'm in the middle of the pack or I'm last, and today I was out front," or something along the lines of, "Hey, I had my best run ever today." It was creating these light switch moments for other athletes in their training. So this is something to keep in mind. I highly recommend the book, and it's just a sort of not phenomenon that I felt like we had to talk about while we were talking about the core and breathing. All right, another tangent we're going to go down, and trust me, we'll be talking about these tangents again down the road. And if you're not hearing from me about it, you're going to hear about these things in the fitness world and in the performance world if you stick with it. Okay, we have an autonomic nervous system, and this autonomic nervous system helps us breathe while we sleep. My heart is beating even though I'm not telling it to. The breakfast I had earlier is digesting even though I don't have to consciously do anything. That's my autonomic nervous system. It's just taking care of business. And our autonomic nervous system tends to be in one of two states or somewhere in between. We're either in a sympathetic state, which is fight or flight or freeze, or we're in a parasympathetic state, which is rest and digest. And ideally, when we wake up every morning, ideally we're going to be somewhere in the middle. Now, some individuals who are drawn highly into that sympathetic state, they're going to tend to have some anxiety because they're constantly looking for danger. And individuals who are dragged into the parasympathetic state in a very strong way might have some depression because they're just going to be so turned down, and that they're not going to have very many stimulants that are encouraging energy. So what you really want to do is you want to be in the middle and have the ability to kind of dip in and out as your environment dictates. So you want to be able to have appropriate responses. And a lot of training, hard training, stressful work or business times in business, or fighting with your girlfriend, your husband, whoever it is, that's going to cause us to be more sympathetic. And when we go get massages and take long walks and maybe do some journaling, those things are going to help us be parasympathetic so we can calm ourselves down. Breathing, this image on the right is your nervous system, the brain, and then the vagus nerve. And you see that vagus nerve comes down, and it's sort of that piece at the bottom that almost looks like, I always tell people, and I think that it looks like a basketball net. Well, that basketball net, that vagus nerve, it sits really close to the lungs, to the base of the lungs. And when we take big, deep belly breaths, we stimulate that vagus nerve. And when we stimulate that vagus nerve, we are influencing our autonomic nervous system to be more parasympathetic, to relax. So think about breathing up into your chest and neck and traps. Maybe in the middle of a workout, you just finished running a hill. You're probably breathing up here. But if you want to recover faster for that next hill you got to run, you actually want to start controlling your breath to come down into the belly. And you breathe in the belly, and because of what we saw earlier from the oxygen advantage, you're going to have better blood saturation when you're breathing in the base of the lungs because of how the blood vessels sit. But you're also going to be able to calm your nervous system down with parasympathetic breathing. And the same thing can be said for creating a sympathetic response. if you are normally a great belly breather, but you start breathing up here, you're going to reduce that stimulation of the vagus nerve, and that will sort of innately cause a sympathetic drive. And again, I've got this 2-year-old daughter at home, and when she's belly breathing, when she's normal, she's belly breathing. But when she's starting to get tired or hungry or cranky, and she starts turning on the waterworks and she's crying, she just starts breathing up right here. But you got to think, that's how so many of us walk around, is just breathing up in here all day long. Whereas when we're born, it's the opposite. We naturally have those big belly breaths, and only when we're upset and furious will we start breathing up here. So breathing, we can actually by controlling our breathing, we can almost control our state of stress. And I'll use this information with how to breathe and when to breathe. I'll use this with athletes. So coaching, having spent years with football, I was teaching them about this, and I would encourage them that when they came off the field to start belly breathing as quickly as possible, because in their time off the field, a lot of times they're having a quick meeting with their coaches. They need to be calm, they need to relax, they need to be able to focus and listen. And then before they would go back onto the field or in between plays, I would encourage them to be chest breathing, because that's when yes, you're wearing pads and there are rules, but you're basically just fighting. And so you want to be stimulated. And sort of the same thing in the weight room. If you've got a big set coming up for a minute or so beforehand, you might want to be breathing up here to kind of fire yourself up, to get your nervous system firing on all cylinders, so that you can go lift a real big heavy weight. But if you've just finished a set, you might want to, and you're exhausted and you're out of breath, you might want to be belly breathing until you are back to regular and your heart rate has dropped a little bit, and then you start the cycle over again. So again, a reminder on that Valsalva maneuver, we can actually breathe to protect our spine. You want to inhale at the top of when you unrack the bar, and you walk back and you get ready, you maybe have a big inhale there, and you would do like a fake exhale where you're going to push against your glottis, and that glottis is that flap that goes between your trachea and your esophagus. So whether you're drinking water or you're breathing in air, that glottis kind of determines where that air and that water go. So you're holding, your lungs are filled up, you're flexing your rectus abdominis and your muscles in your abdomen back against those lungs, with that air coming up to here, pushing against the glottis. And you go down to the bottom of the squat, and then you're coming up through that sticking point, that hard part. And then once you're through there, you're going to exhale. And that's how you're going to do the Valsalva maneuver in a given rep. And then that image on the right is a member of a famous jiu-jitsu family, the Gracies. And he's in the movie The Incredible Hulk. He's teaching Edward Norton how to breathe to stay calm, and just like stressing the importance of breath work in sport. And comic books are cool, so I had to throw that in there too. So Edward Norton turns into the big giant Hulk at some point. So you might want to check it out if you haven't seen it. And that's all we've got today. I hope you guys picked up some good things there. I know we went on a few tangents, but that's the interesting about the core. The interesting thing about the core is it's going to be a combination of knowing your muscles, your bones, and your nervous system. And also just how those lungs work. They're kind of interesting. There's so much more to those lungs than maybe you've ever kind of thought before. And honestly, it just over time, as I learn more, the more I learn about the lungs and breathing, the more I realize I don't know. So hopefully this helps, and we'll see you guys coming up in our core activity days.